My friend Ben is a retired surgeon who suffered a stroke a few years ago. He's now bedridden, paralyzed on his right side, and was recently moved to hospice. His wife Julie has Parkinson's disease, macular degeneration, and a host of other chronic conditions. Because of her limited vision, she can't use a smartphone or a computer or read a book. A mutual friend introduced me to Ben and Julie after they expressed concerns about not being able to afford the healthcare coverage offered by Ben's former employer. Working together, we were able to move this couple to a Medicare plan that offers far better coverage and that saved them nearly $10,000 per year. Ben and Julie are dealing with a lot of health-related issues right now, but healthcare coverage is not one of them. Hello, my name is John Leary, and I'm the founder and CEO of Health Perspectives. I'm making this video to tell you my why I created Health Perspectives, and why it may be important for your organization. When I left graduate school many years ago, my father was dying of colon cancer, and my mother had just been diagnosed with Alzheimer's disease. I spent my nights in the ICU, keeping Dad from pulling the IVs out of his arms when he hallucinated. And my days were spent walking beside Mom as she adjusted to life without her childhood sweetheart and a mind that couldn't work like it used to. After my dad died, and we gradually lost my mother, my career in financial services lost its appeal, and healthcare seemed like a place where I could put my education and my experience with my parents to good use. That led to a long career journey that included positions as a hospital administrator, a home healthcare manager, a health insurance executive, and many other health-related roles around the country. And along the way, I spent many hours talking with senior management of employers across the country about the challenge of enhancing employees' health while managing healthcare costs. I haven't walked in their shoes, but I certainly have sat in their offices. Health Perspectives was formed to leverage my many years of personal and professional experience to focus on helping older people make an informed decision about their healthcare coverage. Coverage that significantly determines their health status and their financial condition. In 2025, we introduced a service called Medicare for Employers to meet the needs of older employees and the companies that employ them. Employees over 65 are the fastest growing workforce segment. By 2030, older workers will constitute nearly 10% of all employees, and they will cost employers almost 2.5 times more than employees between 19 and 64. However, with a robust library of information, a suite of simple self-service tools, and access to licensed Medicare advisors across the country, older employees and dependents can make an informed decision between the employer's group plan and Medicare. In a recent study conducted by Kaiser Family Foundation, 50% of Medicare members rated their healthcare coverage as excellent, higher than any other form of healthcare coverage. This very high rating reflects Medicare's 3 unfair advantages. Number 1, an employer typically offers 1 to 4 options to their employees. Medicare offers 40 to 50 options, allowing individuals to have a more customized healthcare coverage fit. 2, Medicare was built specifically for those 65 and older. Employers can't focus on just one age segment. They need to be all things to all people. Number 3, on average, employers pay 2.6 times more than Medicare pays for the same healthcare services. These unfair advantages are an opportunity for both employers and employees, an opportunity to reduce the company's healthcare budget and the out-of-pocket cost for the employee. And it is an opportunity for older individuals to have healthcare coverage that is a better fit for them, just as it is for Ben and Julie. Every few weeks, Julie and I have a routine. She calls me and pretends that she can't read or doesn't understand an explanation of benefits letter she has received from Medicare. I pretend that this could be very important and that I should come over and review it with her. And when I visit, I'm usually bringing something chocolate that my wife has made. And while we enjoy the chocolate, Medicare is forgotten, and we spend time talking about her life with Ben. And for a few minutes, she remembers what it feels like to be young and healthy and in love. And in those few minutes, I'm reminded of my why. If you are an employer with an aging workforce that wants to meet the unique healthcare needs of these older employees while keeping an eye on the bottom line, reach out to see how Health Perspectives can help you reach those goals. Thank you for listening to my story about my why.